What's going on, everyone? Happy Sunday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Sunday edition of the Virus Update for Sunday, October 27th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make you sick, including COVID, flu, Norovirus, RSV, and many more. Today we're going to talk about several viruses. It's Sunday. We do usually spend an extra amount of time taking a look at wastewater on Sundays. But first, we do have several things that we need to get through, such as today's news, which I talk about every day. The daily news, some daily numbers, take a look at state data for COVID and other viruses, all with one goal: to keep you informed and safe. You don't hear enough about this in the news. It is very underreported on TV. Right now, the big picture is the election, and rightfully so. The election is important, but I think because of all the attention being on the election, a lot of people don't realize COVID, that's going to start going up soon. Flu, it's starting to show up in places. RSV, it's starting to show up in the south. I mean, viruses, we're starting to come into the winter surge of viruses, and you need to be prepared for what is coming. So if you're new to my channel, subscribe down below, give this a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. Alright, starting off today with something we usually show on Saturdays, but it just got posted last night after we already had the Saturday video out, and that is the weekly COVID update for Italy. I know I have at least a few people here who watch my channel who are from Italy, so here we are. And we do note this week the deaths, 116. That's just down by one. It was 117 the prior week. New cases, 8,662. That is a number that is dropping. That is some good news. And you can see here, Italy also did have a summer wave. They peaked, they dropped. They had a fall wave. They peaked, they dropped. And there'll probably be another wave there around the holidays. I'm just assuming that there will be, because that tends to be the case with most countries. Taking a look at what's going on with patients in the ICU. It was 86, now it has dropped to 76. This is all some good news here. And we can see patients in hospital at this time. It shows 2,274. That is down just ever so slightly from last week, but with cases dropping, that should continue to drop as well. And the positivity rate is now down to 9.6%. And the case fatality rate, because, you know, deaths lag in a wave, is now at 1.3%. Alright, moving on to this. Yet again, another weekend where we get a news drop on H5N1. Another human case of H5N1 bird flu has been reported in the state of Washington. This is now taking their total to 8, and 23 cases in the U.S. so far this month. It's October 27th. We're coming near the end of the month. I would like to say I think that's going to be the end of the cases for this month, but who knows? We could tack on more. I mean, this again, I keep saying this over and over again. It's an evolving situation. Who knows what the heck is going to come out of it? But the fact we continue to see cases is not a good thing. The only good thing is there have been no deaths from H5N1 bird flu so far with all these cases in the United States. But it's not good to continuously see cases popping up here and there, whether it be from animals or however they are occurring. Alright, taking a look at this now. Just basically, I'm going to read a headline here. And this is something we probably suspected, or many people probably suspected already. Many pandemic deaths attributed to natural causes may have actually been due to COVID, study says. So in other words, our actual death count in the United States could be an undercount. I personally believe that it is, and a whole bunch of other people believe, yeah, our death count was probably likely an undercount, and it says more than 1.2 million deaths have been reported across the U.S. with COVID as the contributing cause. Alright, moving on. If you want to read this full story, at some point I think I am going to try and get a thread together for today's news stories. I'm going to try and get back to doing that. It's not going to be done right away, though. It's probably going to be later this evening. I'll leave all the tabs up so I remember to do that. All right, taking a look at this. COVID-19 mortality risk twice as high among people with cancer. Yes, that's right. This is not good. Individuals with cancer had significantly higher risk for COVID-19 mortality than the general population. Men, unmarried individuals, and Hispanic and African American individuals had an elevated risk. It's just not good. People with cancer had more than double the risk for COVID-19 mortality than the general population, according to study results. Older adults, men, unmarried individuals, and Hispanic or African American individuals exhibited elevated risk. Results of the population-based study showed. Want to read the full study? It's definitely making it onto the archives on my website. Again, I'll have this all left up here to remind myself later this afternoon or evening when I get a chance to add this. All right, this is interesting. Hugh Freeze, who is a football coach, is battling an illness. He was late to travel to Auburn versus Kentucky yesterday, and I'm seeing a few things coming out of this. It's not the first time that he has had a illness while he was coaching the Tigers, and it also sounds like it could be food poisoning. Yeah, rather interesting, but again, it's not the first time he's been sick, so I mean, there's a lot of people that are just continuously getting sick with absolutely no explanation whatsoever. All right, moving on, just a reminder, my website is datareport.info. Maybe you want to look up some news from previous virus updates, which, again, we haven't updated that. Look, October 5th was the last time I did a thread for that. I just don't always have time. But maybe you're about to visit a doctor because you just had COVID and now you're experiencing a new health problem and you want to talk to them about it. Well, make sure you look up here at my archive of studies and click on a study that may pertain to something that occurred with you post-COVID infection. And I'm always constantly adding new studies. Every week, I'm at least adding some new studies as I find older ones and, of course, as newer ones come out. And I would say at this rate, yeah, we are well over 100 studies. Do we have 200? Yeah, I think we might even be close to being over 200 different studies of all things COVID related. And of course, there's a whole bunch of other stuff. Datareport.info. And if you want to become a member, it is free to do that. Anyone can post in these sections on my site. Taking a look at the allergy level, which we're going to be retiring pretty soon for the winter. We're going to be hibernating this for the winter. Pollen levels, I should say. But let's see what happens over the next several days. It's going to get warm in the mid-sections of the country. That could, bring pollen levels back up once again. But you can see here that it is yellow in the south. And taking a look at air qualities, yes, we are using purple air once again. There are still some problems in the west and just some isolated problem spots elsewhere in between, especially in the southeast. We can see here there is some orange showing up today, and there are still some red areas out in the west. Alrighty, want to learn more about climate and weather? You can do that over on my Climate Data Report X account, and check this out. I did just post a video up on my Climate Data Report YouTube page. Yeah, fall severe weather season's about to kick into swing, and swing into gear, I should say. And yeah, the midsections of the country, it's going to be an active period over the next 7 to 10 days, starting up as early as Tuesday and Wednesday, then another threat again next weekend. You can go see that video that I posted there on Climate Data Report. All right, taking a look at what's going on in Philadelphia for yesterday, 786 EMS incidents were reported on Saturday. Taking a look at what's going on in Montgomery County, Pennsylvania right now, 15 EMS calls. And yes, I am seeing Upper Providence, Montgomery County, cardiac arrest. And oh, what's this down here? Upper Dublin, that's only about 20 minutes from where I'm at. Yikes, Upper Dublin, Montgomery County, Pennsylvania, has another cardiac arrest. That's 2 cardiac arrests. Hopefully we don't see cardiac arrest. Well, never mind. There's cardiac arrest in Chester County, Pennsylvania as well. That's 3 calls for cardiac arrest right now. Wow, not good. Alrighty, taking a look at Canada. The viral activity level for COVID-19 is low at this time. Flu A is also listed as low at this time, and the viral activity level for RSV is listed as moderate. Alright, Walgreens for this week. The positivity rate for COVID was 16.2%. That was down by 0.8%. Again, we're not dropping as much. It's still dropping, but that drop is quickly starting to slow. And 17% the prior week. Testing still down, but I suspect maybe in a few weeks, or maybe as we get closer to Thanksgiving in November, we will start seeing testing go back up. And you can clearly see here that slowing of the drop of the COVID positivity rate. All right, I forgot to show this to you yesterday, and I'm going to make sure we get to see it now. This is the variant update for this week. KP 3.1.1 COVID variant leads the way at 57%. XEC leads the way at 17%. And remember, this is very important to remember, each variant can hit a country differently. So what may be happening in the UK could be a completely different story of what's about to happen here. And speaking of the UK for this week did see a drop in cases. But probably as we get closer to holiday, they'll probably see another wave yet again, because that's what's been happening in the UK. UK has been doing multiple waves. Summertime, they went up, then they dropped, then they had a much larger wave follow a few weeks later. So they don't tend to do just one long wave like what we did in the summertime. As you can see, they did multiple summer waves. And so that's how sometimes it works there. Taking a look at what is going on now with epidemic status, and we can see here epidemic status for flu. It's starting to increase in several states, and it's starting to increase in a few states for COVID as well. New York, Michigan, Ohio, Kentucky, Tennessee, Arkansas, and even in Georgia. All right, let's get over to the wastewater map, and we're going to go region by region here with the CDC wastewater map. And first off, I have to tell you, yes, COVID can be tracked in wastewater. On this page, it's COVID. When we go over to WastewaterSCAN, there's a whole bunch of other viruses that can be tracked in wastewater. If you've never seen one of my videos before where I show wastewater, it's actually really cool how we can track the levels of a virus just through wastewater treatment facilities. Yes, they actually test for these viruses. Now, if you've never seen this map before, there's several different colors. The gray sites, they're not updating. White, they're brand new sites, or they're returning to the map. Dark blue would be very low levels of COVID, and then you see two other shades, which would be low to near moderate. Orange definitely is moderate to high, and then red, yeah, that's really high levels of COVID. So starting off in the Northeast, we do see the further north you go, the higher the COVID level. But New York State is doing really well right now. A ton of low sites. In fact, across the United States, there's 408 sites that's in that dark blue category. Pennsylvania, we do see some lighter shades of blue. And New Jersey, South Jersey has a few lighter shades. But close to New York City is not doing too bad right now. And then Washington, D.C., what's going on there? I think this is Washington, D.C. This is Maryland. And it does look like there is an orange site, but it is still dropping at this time. And then we see Prince William and Fairfax, Virginia. That is also still dropping. Yes, it looks like Washington, D.C. is not really coming up at this time. But anywho, continuing on, so we make our way down to the south, not seeing much in the way of red sites at this point, which is some good news. We do see in Beaufort, South Carolina, there is a red site there, but look at that. It's dropping, and we see just a few orange sites in Louisiana. Texas is in the blue. Still relatively low for you. Then we come up to Ohio. Ohio is in the blues as well. I can recall back in the summertime, the majority of Ohio was red and orange, really bad. Eventually the oranges will come back as we head into, say, around Thanksgiving time, but right now, you're still in a lull at this point. Now, we know that lull is slowing in Ohio, but right now it's still in a lull. Chicago is still doing very well. Michigan is also still doing well at this time. However, we're going to look at that on WastewaterSCAN in just a moment. I am seeing one red site in Colorado. That is El Paso, Colorado, is red at this time. 303,000 population at that wastewater site. Still blue in California, which is still good. And coming up to the Pacific Northwest, I don't give enough attention here. I should give more attention here. Taking a look at what's going on in Washington and Oregon, while somewhat good, we do see that there are still some sites that are listed at orange and red at this time, especially in Washington and in Oregon as well. I do see a red site in Oregon, and we do see Marion, Oregon. It looks like it's leveling off after, wow, a long duration rise. That wastewater site got hit really hard with COVID And we can see here, it does look like things are improving in this region. And this region got hit so hard, it'll be interesting to see what actually comes when the winter wave starts up. Maybe there'll be a little bit of immunity for you just because of how hard you got hit. All right, moving on here to the central region. Not too bad in the plains. Now, let's take a look at a few other viruses. And we'll start off once again in the Northeast on WastewaterSCAN. Let's see what's going on in Boston. We'll just do maybe about 5 or 6 sites here on WastewaterSCAN. You see Boston, Massachusetts. Look at COVID. Yeah, that's not good. Starting to see the early stages of a rise once again. It was dropping, but now COVID is listed at medium and rising once again. This could be the start of your winter wave. RSV at this time is low. Influenza A, Influenza B, HMPV all low, but Norovirus is now medium, and it is on the rise. Mpox, no detections of that at this time. Let's come down here to Stamford, Connecticut. And in Stamford, Connecticut, we see COVID levels. They were dropping. Now they've leveled off. Could you soon follow Boston? It's possible. RSV is low. Influenza A is low. Influenza B is still low, but it is clearly starting to rise now. HMPV is low, and Norovirus is rising and listed at medium. Mpox, no detections of that at this time. Now let's make our way down into Florida. And how about we come down to Miami this go around? We don't go down to the Miami area enough, and we do see here that the COVID levels are still low. RSV has been rising, and it is now listed at high. Note to myself, I'm going to have to start searching for any news stories that may pop up with that there. Influenza A is also high. So RSV and Influenza A, yes, they really are starting to be on the rise down in the Miami area. Influenza B is still low. HMPV is low. Norovirus is listed high at this time, and just level to rising ever so slightly. Mpox is not being detected at this time. Let's go up to Michigan now and see what's going on there. Remember, in Warren, Michigan, we did have a rising wastewater site. Well, now it's starting to drop a little bit, but take a look at this. RSV. It's still listed at low, but that may change to medium pretty soon because RSV is starting to rise. Influenza A is low, Influenza B is low, HMPV is low, and Norovirus is flat at this time. Mpox, not seeing any detections of that at the moment. Now let's make our way further out to the west. How about we come down to the Mid-South first? Can we take a look at what is going on in the Dallas area? Sometimes we can, sometimes we can't. Let's see what happens. Now, it looks like the data here is relatively incomplete, but I do note this. This is actually showing up. Norovirus. Wow, it is really rising. And it is listed at high at this time. And we also note here that Mpox, as of October 13th, there was a detection of the Clade 2 strain. Remember, Clade 2 is the old strain of Mpox. That is not the new strain. Let's come out to Las Vegas. I have to show you Las Vegas. Why do I have to show you Las Vegas? Take a look here. Your COVID levels are now listed at high, and they do continue to rise at this time, which means you are clearly in the fall-winter wave of COVID. It is clearly underway for you. RSV, Influenza A, Influenza B, and HMPV all low. Norovirus really high, but maybe some signs are starting to drop. If you note, it did do that before, and then it just went up again. So Norovirus is really high for you at this time. Mpox, no detections of that Clade 2 strain. Taking a look now at what's going on in California, let's come down to San Diego if we can. And in San Diego, we do note SARS-CoV-2 coronavirus is low. RSV is low, Influenza A is low, Influenza B is low, HMPV is low, Norovirus is low at this time. So you're one area that's actually not seeing a rise for Norovirus at this time. And your last detections of Mpox were back in August. Alright, going further north, can we come up here to Idaho? Let's see what's going on in West Boise, Idaho. And in Idaho, COVID levels are listed at medium and rising ever so slightly. RSV is low, Influenza A is low, Influenza B is low, HMPV is low, and look at Norovirus. Oh my, very high levels of Norovirus there. That is not good to see. Mpox is not being detected at this time, so that is some good news. And real quickly, I just want to show you the national levels here, because we can see nationally, COVID is medium, the drop's continuing, it's slowing slightly, RSV is low and dropping, influenza A, influenza B still very low, but you saw there are some sites where influenza A and RSV are rising. I think eventually the national trend will probably change within the next week or two, and Norovirus, it already has. You saw several wastewater sites with Norovirus now rising and listed at the high category, so yes, that is definitely an issue at this time. Alrighty folks, that does it for the Sunday virus update. Of course, we will have another virus update again tomorrow. If you enjoyed this update, give it a thumbs up, hit that notification bell, share this video with anyone you know, and subscribe down below, and leave your comments down below. Thanks for watching. I will see you all again next time. Until I see you again next time, have a fantastic Sunday afternoon.